So students, we are going to discuss a question that activation of M3 receptors result in increase in calcium level, then how they cause dilation in blood vessels. So there is an assumption that whenever there is increase in calcium level within the cells, there must be constriction, but it does not always happen. So what happens in case of M3 receptor activation? No doubt activation of the receptors result in increased level of calcium, but ultimately in the end we are getting a vasodilatory effect. So why does it happen? This is because of a paradoxical effect. We know that M3 receptors are associated with GQ protein, and activation of these GQ proteins definitely results in increased level of calcium ions within the cells. So there is an assumption that if there is increased level of calcium within the cell, then there must be constriction of blood vessels. But no, it do not happen. Why? Because whenever there is activation of M3 on the vascular smooth endothelial cells, what happens that there is increase in synthesis of nitric oxide as well. So this nitric oxide is lipid soluble. So this lipid soluble nitric oxide now diffuses into the vascular smooth muscle cells, where they causes the relaxation and vasodilation. So therefore, this paradoxical effect was due to the nitric oxide. Now we will discuss this in detail. We know that nitric oxide is a endothelium derived relaxing factor and it is lipid soluble as well. So whenever there is activation of M3 receptor by a ligand, by any agent, but this nitric oxide, what these M3 receptors will do, they will activate the GQ proteins. As a result, there will be production of second messengers, IP3 and DAD, which will cause increase in the calcium level within the cell by opening the calcium channels. As a result, there will be influx of calcium. Secondly, they will cause the release of the calcium from endoplasmic reticulum. So there will be increase in calcium level by the release of the calcium from within the cells as well. As a result of this increase in calcium, this increased calcium will activate the calmodulin. So this calmodulin now will activate an enzyme which is nitric oxide synthase. Now this nitric oxide synthase is actually converting the L-arginine into nitric oxide. So what this nitric oxide will do, that it will cross the smooth muscle membrane. So after crossing this smooth muscle membrane, it will bind itself to reduced heme iron on the beta subunit of an enzyme, and name of that enzyme is guanyl cyclase. So what this is doing, this nitric oxide is actually binding itself to guanyl cyclase. As a result, there will be increased production of cyclic GMP from the GTP. So whenever there is increased level of cyclic GMP, as we have discussed in this figure, there is increased level of cyclic GMP, that is cyclic guanosine monophosphate. So as a result of this increased level of cyclic GMP, there will be activation of the protein kinases. There will be opening of the potassium channels. So as a result, there will be influx of the potassium ions. As a result, there will be hyperpolarization. There will be closing or inhibition of the calcium channel. So as a result, there will be decrease in the calcium level within the cells, and ultimately what will happen, there will be the relaxation of the cells. So there will be a vasodilatory effect. So this figure is actually representing that with the increasing level of the cyclic GMP, there is decrease in the calcium. As a result, the myosin head detaches themselves from the actin. So as a result, what we are getting the smooth muscle relaxation. We are getting a vasodilatory effect. So this is a Lippencourt's diagram, which is also representing that whenever there is an increased level of nitric oxide, there is increase in cyclic GMP. There is dephosphorylation of myosin light chains. As a result, there is vascular smooth muscle relaxation. There is a vasodilatory effect.